So you're having some trouble with your lungs, is that right? Okay. So do you want to just explain to me what you're experiencing? Okay, and any chest pain? Right. Okay, well, let me start off by having a listen to your lungs. Okay. Right, it's going to be a little bit cold. If you could just pop your top up for me. Okay. Thank you. There we go. Okay, so if you could do a deep breath in, so... Okay, thank you. Okay, if you could just do a few more deep breaths in, so... And out. Okay. And in again. And out. Thank you. And in. Okay. And out. Okay. And in. And out. And in. And out. And in. And out. Okay, I'm just going to have a listen to the back. Alright. So, in for me. And out. Nice big deep breath. And out. And in. Doing well. And out. And in. And out. And in again. And out. Okay. It does sound a little bit like the lungs are struggling. Sounds like they're a little bit tight. Are you experiencing any tightness or shortness of breath right now? You are. Okay. Alright then, so what I'd like to do is just a few quick tests just to check your overall health, and then I'll try and investigate a little more what could be the problem. Okay, so if you could just roll your sleeves up, just on one side, that's fine, thank you. Okay, let's pop your arm in here. Okay. Okay. Let's just have a little listen Doing really well. Okay, that's normal, alright. Pressure. It's also normal. Alright, so it does seem to be possibly a localized thing, so something that's just affecting your lungs. Okay, I'm just going to have a look in your mouth to see if there's anything obstructing the airways. Okay, so if you could open up nice and wide. Alright, I'm just popping this in, and if you could say ah. And again, ah, just try and push your tongue down. Okay, that looks really normal actually. Okay, so we've got a temperature. No. Okay, so do you smoke? Okay, and does the symptoms, or do these symptoms get worse after exercise? They do. Okay, and how old are you, if you don't mind me asking? Okay, and so have you experienced these symptoms before as a child? When you were very young, but not since? Okay, I do think it might sound like a little bit of asthma. Yeah, it's nothing to worry about. There are lots of people that have it, and it doesn't really have any impact on their life, okay? Especially if it's not very serious, okay? Some people do have it a lot worse than others, but by the sounds of your lungs and the symptoms you're experiencing, it doesn't sound too bad. Okay, so I'd just like to try something. So I have this inhaler, okay, so this is a reliever, okay, so what will happen is you would only use this if you are in need, feel like your airways are closing up, okay, so this should only be used very rarely. And if you do have your asthma under control, you shouldn't really be using this at all. Okay, so this is more like just for emergencies. Okay, unfortunately, you are going to have to carry this around with you all the time. Okay, just keep it in your bag. Don't worry about, it doesn't have to be in your hand or anything like that, just in a bag or in a pocket, okay? And if you really don't want to carry it, or you can't because you're swimming or you're at the beach, just make sure it's nearby, okay? Or ask someone else to hold it. It's very important, okay? So what you do, so this can come out, okay, but you don't need to do that, but you can test to see how full it is. Okay, so that stays in there. So what you do is you take off the lid, you give it a shake, alright, and then you do press it once and a nice deep inhale, okay, and then you hold it. Sometimes it may help to close your nose, okay. Make sure that you're actually having a really deep breath, okay, and then just wait 10 seconds before the next puff. Sometimes if you take too much of this, okay, it can actually make you feel a little bit lightheaded and a bit shaky. Okay, so that's that one. So next we have the preventer. So this is something that I advise you keep by your bed. So you take a puff of this in the morning and a puff of this at night. Okay, at the moment I recommend one puff. Okay, one puff in the morning and one puff at night. It's the very same procedure as the other one. Okay, it's just a different type of medication, and this will actually hopefully prevent the symptoms. So if you take this in the morning and at night, you shouldn't be using this, okay? And if you are, you need to come back so we can have a look at your asthma again. Okay, right, so let's do a puff of this first, okay? I'm going to try and see if it's improved the airways. Okay, so nice deep breath. Okay, just breathe normally. How does that feel? Is that improved? Okay, let's have a listen. Right, if you could just lift your top up. Thank you. Okay, so a nice deep breath in. Okay. And out. And in. 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 And out. Okay, and then listening around the back. So nice deep breath in. Okay. And out. And in. And out. And in. And out. And in. And out. Okay. Sounds a lot better. Okay. That sounds a lot better. How do you feel? Good. Alright, so let's do a puff of this then. So this should start to help prevent the symptoms coming back. Okay, so get ready to take a nice deep breath in. Okay. And just breathe normally. Okay. Alright then. One thing that you must remember to do, okay, after you take this in the morning and at night, rinse your mouth out, okay, because it can change the pH of the mouth, okay, so that's one thing to remember. So all I do is keep the blue one in your bag, brown one by your bed with a glass of water every night, okay, and it won't really make any difference, okay, it's just if it starts getting worse then we'll need to think about implementing some more steps and increasing the medication. Alright, let's have a look inside your mouth again to make sure it's not reacting. Open nice and wide. Okay, that looks great. So the other thing that I wanted to give you was some peppermint oil. Okay, so this is actually peppermint and eucalyptus, alright, so it's it opens up the airways, okay, and it might actually help a little bit more and just allow you to feel the deep breath, okay. It sounds a bit funny, but you'll know what I mean once you've inhaled a bit of it. So I'm just going to hold it underneath your nose and just take a nice deep breath in and out. Okay, and again. Yeah, it kind of feels like your airways are opening. Okay. Right. Let's just have one more listen. Okay. Let's do a few deep breaths for me. That's great. Okay, sounds good. Right, so just before I let you go with these inhalers, I would just like to see how you do it, okay, so that I know that you are comfortable and confident with using it. Okay, so I'm just going to put this in your hand, alright. Now, just show me what you would do. Good. That's great. And again. Okay. Perfect. Okay, and then it's the same for the other one as well. Alright. So do you have any questions at all? No. Okay. Alright, well in that case, take care, alright? Make sure that you go to A&E if you do have any serious trouble with your breathing. Okay? Alright, take care.